bienvenidas a la Mesa Redonda Farmacia Europea referente en Salud Pública. Esta sesión se llevará a cabo en inglés, por lo que os invito a utilizar los auriculares para la traducción al español si fuera necesario. The main objectives of these roundtables are to explore the role of pharmacy in public health, and secondly, to assess the impact of pharmacy services on patients and healthcare services. We are going to discuss this with Emma Paulino, member of the board and president of the Lisbon and South branch of the Portuguese Pharmaceutical Society, with Darragh O'Loughlin, Secretary General of the Irish Pharmacy Union, with Stephane Pichon, President of the Regional Council of Pharmacists of South of France and Corse, and with myself, I'm Ilaria Passarani, Secretary General of PGU, the pharmaceutical group of the European Union. We are starting a little bit late and we have less than an hour, so I would suggest that we have the 4 presentations all together and then we open up for questions and input from the audience. I'd like to start with a very short presentation which is intended to provide an overview from the European perspective, and then we will hear specific experiences from the national level. I'm sorry, there were some technical problems with my presentation, so I will do without. And before starting, I would like to say just a few words about PGU, my organization. PGU is the European Association representing community pharmacists. PGU members are the national association and professional bodies of community pharmacists in 32 countries, including EU member states, EU candidate countries, and EFTA members of the European Union. And we are honored to have Mr. Jesus Aguilar Santamaria as our current president. The aging of the population, the technological advances, new public health threats such as antibiotic resistance, but also evolving patient expectations and shrinking healthcare budgets are putting under pressure European healthcare systems, but also healthcare systems around the world. And we all know that an increasing portion of health expenditure is on pharmaceutical and on chronic diseases. All these factors are calling for a change. And community pharmacy is changing too, to respond to these challenges and to better meet patient needs. And community pharmacy is changing by shifting the focus from dispensing medicines to patient care and quality of services. And the pharmacy services aim to achieve a triple aim. First, of course, to provide better quality of care and improve health outcomes, but also to reduce costs for the healthcare systems. And all this makes sense, and because the cost-effective argument is simple and is understandable also by those who are not experts of the sector. More visits in the pharmacies means less visits in emergency care and in hospital settings. And if we look at the main trends in pharmacy services, we observe that the total number of patient-centered services are increasing. The core pharmacy services such as dispensing, compounding, medication management, and emergency care are available in all European countries. But over the past decade, we also saw, and we are seeing, an increased number of advanced pharmaceutical services that are offered to patients, such as vaccination, smoking cessation, health checks, chronic disease management, early screening, and testing. And if we look at the big variety of services that are offered in pharmacy throughout the EU, we clearly see the role of pharmacists in health promotion, health prevention, and health protection. I will start with health prevention. We know that more than 1.2 million deaths per year could be avoided through better public health and prevention measures, and health checks are available at community pharmacy for patients. Just some figures. At the moment, is it possible to measure blood pressure in 27 countries in the EU, weight in 28 countries, blood glucose level in 23 countries, and cholesterol in 22 countries. When it comes to health promotion, In 21 European countries, pharmacies offer smoking cessation services, and they also support a number of national and regional public health campaigns, including, for example, the European Antibiotic Awareness Day, but they also provide well-being advice and support for self-care. When it comes to health protection, in 12 countries, European patients can be vaccinated within community pharmacies, and in 8 countries, including Spain, pharmacies provide a needle and syringe exchange service for intravenous drug users to prevent HIV and hepatitis and other type of diseases. Last but not least, all pharmacies across Europe provide emergency care. But against this background and this short overview of services provided across the EU, what is next for community pharmacies? What is the way forward? The truth is that the case for the pharmacist's contribution to the health systems in the form of services has never been stronger. The evidence confirms that pharmacist intervention improve patient outcomes, but they also help saving money. However, we also know that services are unlikely to be sustainable on a large scale without financial support. We also know that accessibility is our major asset, and it needs to be preserved along with logistic efficiency. New services, like the ones I just described, are very important, but the dispensing function is also crucial to our place in the communities. And so I think we need to build on the quality, on the professionalism, on the added value of community pharmacies and make the case vis-à-vis policymakers to make sure that pharmacies are rewarded for their vital contribution to public health and to the healthcare systems. So this was just, as I said, just a general overview from a European perspective, but now we'll hear a specific example and from the national level, and we start with Emma Paulino, who will share experiences from Portugal. Thank you.
Hola, buenos días. Voy a hablar en inglés para que todos hablemos la misma lengua, pero si tienen después cuestiones me pueden abordar en portuñol, porque soy capaz de entender. So I will be speaking in English, and thank you very much for the kind invitation to come to this Congress and present a little bit about pharmacy services in Portugal. And I would like to say that my presentation will go through a series of services, so many of the services that pharmacies are now providing in Portugal, but I will not go into detail on any of those services. So if you would like more information, obviously you can afterwards ask about it, or you can meet me during the breaks and I will be more than happy to expand on these services. So I will wait for the change in slides because I will not be speaking about Irish pharmacists. That will be my friend Darragh. We could do that next time, present each other's presentations. Okay, so I do not have any introductory slides explaining what the situation of community pharmacies in Portugal is, but because I'm sure that you know most of it, so we are a small country with 10 million inhabitants, and we have approximately 3,000 pharmacies running, which means approximately one pharmacy per 3,500 people in Portugal. So that's the panorama. As you also know, in 2007, we lost the pharmacist ownership. So now everyone can own a pharmacy in Portugal, but because there are no chains allowed, so each owner may only own up to 4 pharmacies, most of the pharmacies still lie in the hands of pharmacists in Portugal. But that was a small preamble to what I'm going to discuss about, which is the way that pharmacies in Portugal are contributing to public health. So I will be presenting some data, and here I really like to highlight this slide because those people in the first picture, those are my grandparents, so my grandfather and my grandmother in front of their pharmacy more than 60 years ago. And as I recall, when I was growing up in the pharmacy, they were always also talking about services and how they could add value to the community. So it's not a new discussion, it's just new approaches based on new needs of the new generations and how the healthcare systems have evolved. So in Portugal, we have been working on developing services for pharmacies for a number of years now. And what I really would like to highlight is that you don't need to wait for legislation to come and allow pharmacies and pharmacists to do certain things like participating in health promotion campaigns or doing pharmaceutical care services, and we've done that in Portugal. So even before the new legislation came in 2007 that allowed community pharmacies to start providing certain services, we were already doing a lot of services in Portugal, like point-of-care testing and health promotion campaigns, follow-up of patients with diabetes, cardiovascular disease. But it is true that when we had new legislation in 2007, that allowed us to expand the number of services that we are providing. And for instance, the vaccination started in 2007 when we were allowed to administer vaccines and other injectable drugs in pharmacies. We have just had a new legislation in 2018 already that expanded the number of services that are allowed in services and clarified that other healthcare professionals may also work in pharmacies to provide services. So now we can have nutritionists, podiatrists, nurses, and other healthcare professionals developing services in our pharmacies, so we are able to provide patients with what we call an integrated healthcare solution, a holistic solution to the problems that many of the patients that visit pharmacies have. So in terms of, I've already talked about this new decree law, and these are the different services that are now allowed in community pharmacies. Most of them we were already performing for a number of years, but some of them are new or have been clarified further in this legislation. And you can see the immunization there, which was already in the previous legislation, but also the nutrition consultations, diabetic food consultations, and others. And importantly, and I will be talking about it, for instance, new point-of-care testing for HIV and hepatitis B and C. So what have we been doing in terms of immunization, for instance? So we all know that usually countries are struggling to reach that optimal immunization rates. So community pharmacies in Portugal have been contributing to achieve those targets. Like I said, we started very early on, and these are some of the numbers. I won't go into any details, but you can see that there are a lot of pharmacies, almost 80% of pharmacies in Portugal provide the service. We have many pharmacies which are accredited by the Pharmaceutical Society to do the immunization, and we have many of the immunizations are provided in pharmacies. We have developed specific educational training for pharmacists to do this. The National Association of Pharmacies every year has a national campaign to present the service to the population, and we are included as a case study in the FIP, in the International Pharmaceutical Federation report on countries where pharmacist immunization is possible. Through this service, we have evolved over time. So initially, when we started all the immunizations, we had to record them on paper, and the patient pays out of pocket, so they pay in the pharmacy for the vaccine and the administration. Now the National Association of Pharmacies has been working with the government, on one hand, to document the immunization, not in a paper, but already in the electronic record. So we have been doing this since last year, and now also working with the government, trying to negotiate that people at risk may also go to the pharmacies and get immunized for free instead of going to the healthcare center, as happens right now. Through this service, we have made several studies that have highlighted that we are getting people who had not been immunized before to be immunized because we are offering it in pharmacies, which are more close to the patient, and we have saved the country a lot of money through this service, and this is why we are negotiating with the government so that they can pay us so we can provide this service for free for the patients who visit us. Another service which we have been developing since a number of years now is the needle exchange program. Again, there has been a lot of evidence showing the value added of this service. I won't go into any detail, but what I will tell you is that we were providing this service for a number of years for free. Then when the new legislation came that decreased the price of medicines and decreased the margins in pharmacies, we said that we were not able to provide this service for free anymore. So the National Association of Pharmacies negotiated with the government to get reimbursement for the service. So now community pharmacies in Portugal are being remunerated, and per kit that we exchange, we are paid a certain sum, which is €2.4. It's a start, so this is the first service that has been remunerated for pharmacies in Portugal. What we are also working on at this moment is the dispensing of antiretroviral medication in pharmacies, in community pharmacies. We all know that these drugs have traditionally been only dispensed in hospitals, and a pilot started approximately 1 year ago to start dispensing this medication in community pharmacies. The first results have been very successful, so patients are very happy because they don't have to go to the hospital. They just go to the community pharmacy. They are willing, so they even think that it is better for them, and they don't feel that the stigma around the collecting the medication. And it is estimated, and the Health Ministry has already announced that this will roll out to other pharmacies in Portugal, because we started with a pilot in Lisbon, but this will be disseminated to the whole country. And now we will be starting with a pilot on oncology medicines as well. Like I said, a new service we are starting in community pharmacies is also the HIV and hepatitis B and C testing, point-of-care testing in community pharmacies. We have just started the education of pharmacists, and we will be rolling out the service in the coming months as well. We have been conducting for a number of years a lot of interventions in many different areas like cardiovascular, respiratory, diabetes, and oncology, so screening programs, follow-up for patients, and these have been very well documented in papers and posters that have been presented by community pharmacies themselves, or the associations like the Pharmaceutical Society and the National Association of Pharmacies. Another project that is now being undertaken by the National Association of Pharmacies is a project that aims to establish, to see the success of pharmacies and healthcare centers working together collaboratively to address the patient's needs in that specific region. So this is a pilot that is going on in one region of Portugal, and it allows for interactions, electronic interactions between the pharmacies and the healthcare centers, and we aim to implement certain protocols for pharmacies to be able to provide services in areas like urinary tract infections and other types of diseases. Another project is also aiming at increasing communication between pharmacies and healthcare centers, and particularly general practitioners. And for this, we have established a way that pharmacies are able to send a message to the doctors saying something about a problem that they have detected, or a certain situation which came from the conversation with the patient, and then we are able to send that message to the physician, and the physician then replies back saying whether the information was useful or not. And finally, we are also developing from the Pharmaceutical Society a number of other initiatives that aim to improve work on health promotion in schools. So we visit schools every year. We have produced a number of books also for little children so that they can start adopting new and better lifestyles for the prevention of disease. And we have been working for the past years on responsible use of medicines campaign with other stakeholders as well. To finalize, we have published a study on the value of all these pharmacy interventions, because all of these, except for the needle exchange, they are provided either for free or the patients are now paying for it. So what we want is to prove our value so that the government starts paying for the services instead of the patient, or instead of pharmacies having to continually do it for free, which is not possible, as we know, with the current economic situation of pharmacies. And we do see, and this is a study that has been commissioned by the National Association of Pharmacies, that patients are very happy with community pharmacies in Portugal. Community pharmacies are where they go first when they have a certain minor problem with their health. And they want more services from pharmacies. So this is a very important study that will help us advocate for an expanded role for community pharmacy in Portugal. And that was it. Thank you very much for your attention. If you have any questions, please do let me know. Thank you. Gracias.
Now we hear the experience from Ireland. Darragh, the floor is yours.
I'm excited to see whose slides I will get. I got
yours,
mine.
yours. It looks like they're
Great.
yours.
Thank you, Ilaria. In my presentation, I'm just going to superficially talk about a small selection of health promotion and public health services that are provided to the public through Irish pharmacies. But first, a brief introduction. Which button? Does anyone remember which button?
The right one.
It's not working. So Ireland is a very small country. Emma talked about how small Portugal is. Ireland is half the size. We have 4.7 million people. We have 1,800 community pharmacies. We have a mixed model of pharmacy. The vast majority of our pharmacies are still owned by a pharmacist and operated by a pharmacist, but chains are allowed. We have Lloyd's, we have Boots, and we have Allcare, but between those three chains, they are less than 10% of our market. Irish pharmacies play a role in health promotion through health promotion, health information, vaccination, needle exchange, and specialty or high-tech and biologic medicines. Where are we now? So first of all, in terms of health promotion, this is not a remunerated service. This is about positioning the pharmacist as the expert in healthcare in the community, to reinforce pharmacists as health professionals and to help to prevent criticism that we are, our perception that we are only retailers of medicines. In health promotion, we collaborate with other organisations, sometimes patient organisations, sometimes the health service, and sometimes we do it ourselves. Examples of campaigns on self-care: we have worked with the College of General Practitioners, we work with the Health Service and with the Department of Health to promote self-care so that people with minor ailments and minor conditions will come to the pharmacy for a remedy instead of going to more expensive parts of the health service. Like every country, our health service has less resource than demand. The Under the Weather campaign, which is online, it's on radio, and it's displayed in pharmacies, encourages people to ask the pharmacist for advice about how to treat minor ailments. It also encourages them not to go to the doctor to ask for an antibiotic when they have a viral infection or a viral condition, because we're trying to reduce the amount of antibiotics that people use as a result of all of the antimicrobial resistance that we are seeing. We run campaigns on children's health to help parents in particular identify minor conditions and treat them at home and to advise them when they should bring the child to a doctor. We've run campaigns on COPD, chronic obstructive pulmonary disease, to help people recognize it, recognize when it is getting worse, and recognize when to seek the pharmacist's advice or their doctor's advice. And we also run campaigns on health literacy so that people who have poor health literacy and poor education can understand the health information that they are being given. A key component of our contribution to public health care is vaccination. We both promote vaccination and promote information and accurate information, and we also do immunizations and vaccinations in the pharmacy. Pharmacists are now, since 2011, a key part of the health service vaccination program. The public recognizes us as vaccinators and appreciates the accessibility of the service that we provide. We have had a very big issue in Ireland, a big problem or a challenge with HPV vaccination, the vaccine for cervical cancer. 3 years ago, we had 87% of young girls receiving this vaccine. Then the scare stories started, the fake news started, the scaremongering on Facebook and on social media and even on TV. And our vaccination rate fell from 87% to 50%. So all of the healthcare organisations in Ireland came together on a campaign to tell the truth about vaccination and to get the facts out. So you can see many of the organisations that participated here, including the Irish Pharmacy Union. As a result of our efforts, the Minister for Health has now spoken publicly about pharmacists as expert sources of information about healthcare and vaccination. He has recognised that we are with the clinicians and the scientists as people who know the facts. The campaign is having some success. We have now moved from 50% vaccination up to 65% last year, and this year we are hoping to get it higher again. Flu vaccination was where we started with vaccine in Ireland. We don't administer the HPV or cervical cancer vaccine in the pharmacies, we just give the information. It's administered by the nurses in the schools. But for flu, Ireland was not meeting the World Health Organization target for vaccinating elderly people against the flu. You can see I have marked Ireland and Spain on this graph, which shows that we were good, we were almost there, but not quite. So now we can vaccinate in the pharmacies. The pharmacy is part of the health service promotion of flu vaccine. We are mentioned beside the GP or the doctor in all of the promotional materials. We as an organisation promote vaccination in pharmacies, advertising on the radio, on social media, and even printed literature which patients receive. Since pharmacists started to do vaccination, we can see that the number of people being vaccinated against the flu each year has increased. The pharmacy contribution to the overall is still small, but because of the promotional work we're doing, more people are going to the doctor for the vaccine. Unlike in Portugal, the health service does pay us for doing it. We get a fee of €15 for each patient that we vaccinate, and the health service provides the vaccines themselves for free. The most important question with any service is, what does the public think and what do the patients think? In this case, we can see, because we ask them, that 1 in 6 of patients who came into the pharmacy for a flu vaccine, it was their first time ever to have the flu vaccine. In 1/3 or 1 in 3, it was the first time in a pharmacy, but 2 in 3 said that they had had it in a pharmacy before, and almost all said they would return to the pharmacy. Why do they like the pharmacy? Because it's convenient, because of the short waiting time, and because for them it's cheaper for the ones who have to pay. Are they satisfied with the quality of the service? You tell me. 95% of them think it's a good service. 93% would recommend it. 99% will come back next year. Another service we provide which benefits public health and for which we are paid. We are not mercenaries, but we recognise that if we provide a service which improves public health and benefits the health system, we should receive some payment for doing that. Needle exchange services operate on the same basis as they do in Portugal, where drug users, either opiate addicts or now we see more steroid users from the gym. So as you can see from me, weightlifting is very popular among other people in Ireland. And the steroid use is increasing all the time. And we see these people coming in for clean needles. We take back used needles, we give out the clean kit. In the kit we have, this, as well as the needle, the alcohol swab, citric acid, and the spoon, and some information. We also take the opportunity to give health advice and health information to the clients when they come in. This service has also been reviewed by the University of Liverpool, who found that the clients felt it was an excellent service. They particularly appreciated the accessibility and the information that they receive. The last service I will briefly mention is the specialty or high-tech medicines scheme. In Ireland, we dispense biologic medicines and biosimilars and other high-tech medicines through community pharmacies. We have done for more than 20 years. The reason for this is because it was too expensive and too complicated for the health service to do it in their clinics, and it was also very difficult for the patients to travel to the clinics to receive the medicines. So now we can order these medicines when they have been prescribed. They will be delivered to the pharmacy, but the invoice, or the bill, la cuenta, will go to the health service. The health service will pay the supplier for the medicine after we give it to the patient. There are significant benefits to this scheme. So the pharmacist benefits because they get a patient care fee each month for each patient using the service in their pharmacy. That fee is currently €62 per month per patient. If the patient does not come into the pharmacy for 1 month, we get half the fee. We are expected to find out why they didn't come into the pharmacy. It means the medication record is kept in one place. It means that as a community pharmacist, I know all the medicines my patient is taking, not just some. For the health service, it means they don't have the complication of buying the medicines, of storing the medicines, and of dispensing the medicines accurately. So they also benefit because they can use our facilities. Those are just a quick sample of some of the services we provide. If you have questions or need more information on these, I'm happy to take questions. And you can also find me on Twitter or LinkedIn if you want to send questions afterwards. Thank you.
Thank you. Thank you very much, Darragh. Now we hear the experience from France. Stephane, the floor is yours.
Where is mine? Hola, ¿qué tal a todos y todas? Es un gran placer, un gran honor estar hoy aquí con nuestra organización hermana, el Consejo General de Colegios de Farmacéuticos. Trabajamos muy bien junto a nivel europeo en la actualidad. Bajo la excelente presidencia de Jesús Aguilar, compartimos modelos similares y exactamente la misma visión de la misión de servicio público de la farmacia. Muchas gracias por su invitación. Me gusta mucho hablar el español pero no me recuerdo todas las palabras para hablar técnico. Yo me voy a hablar un poquito del inglés, porque los franceses no están buenos en lenguas extranjeras. French pharmacy. It's not the same one. You know that I saw that we have nearly the same number of community pharmacy in France as in Spain. About 21,000 pharmacists. You have 21 and 77,000, I think, all over the country. But the main thing is we are on each part of the country, and we have no more doctors, medical doctors in France. It's very important because a lot of pharmacists are dying now because there is no more doctor in the campaign, in the country, and only in the big city. The community pharmacy in France, they have in 29 the law refined the mission because the Ministry of the Health was a pharmacist, so he gave us a lot of new missions Okay, the contribution to primary care and condition care, I will speak it about later about it, because there is a problem in France with emergency. In the hospital, there's a lot of traffic jam in the hospital, so people can wait during 6-7 hours in the hospital for a little pain. Cooperation with other health professionals, it's quite difficult to do it because even if we have to work together, I think it's the same thing in Spain. Sometimes we have, our field, and they don't want to share the field. They say, it's my job, it's not your job, so we will take about it if you have questions about it. And therapeutic education and support to patients, because the prescriptions are very, very difficult to be understood by the people. So you listen about the social network, and they make it it's very bad for the people because they don't know the real good information for their health. For the next year, you will have the vaccination for all the people in France authorized by pharmacists. During 2 years ago, from 2017-28, we have 2 pilot countries in France, and it was a very, very good experience because of with the help of Irish people, Irish pharmacy, and Portuguese pharmacy. We can say to the government, we can do it. We are allowed, we can do it because you don't use the pharmacy as you have to use it, because we are in all over the country, and it's very easy for a patient to have a vaccination in a pharmacy because they trust in the pharmacy, and you see they lose a lot of money because when the people buy the vaccine, they put it in the fridge and it's lost because they don't do the vaccination. So it's very easy for the people to do it in pharmacy. Actually, we are allowed to do the vaccination to old people, 65 people to the oldest people, but it was very difficult for us because they put, I don't know the road, a lot of difficulty for us. A new local, you have to take care of the people during half an hour after the vaccination to be sure the people is good. They don't do that with the other professional in the house. So it was a success in France with all this problem for the pharmacists. Next year, all the pharmacists in France will be allowed to vaccinate against the flu. And we have a special thing in France, which is the dossier pharmaceutique shared medication record. On the card, la tarjeta, you have all 4 last months of medicine, of the treatment of the people. If we go to the hospital, we have a special contract with the emergency in the hospital. They can use the card and know all the medicine you have during the 4 last months. It's very important because in France, medicine is free. You don't pay for that. So people use the doctor as they use something very free. They go to see 4 or 5 doctors. They go to, after the generalist doctor, they go to see the dermatologist, they go to see the cardiologist, and another one to be sure it's a good diagnostic. So they have a lot of medicine prescription, different prescriptions. So you can see with that dossier pharmaceutique, the interaction, and if they take, with the generic, they take twice the medicine for the blood pressure, so they have problems. So with that, the pharmacist can be the pharmacist can be the professional to see if they take the good treatment, if they don't take twice the medicine, because it's very difficult for them to know the name between the principal and the generic. So you have it, it's very important. And now you can see next year they use it in the DMP, dossier médical partagé. You can share the medical folder, because you can have biologic analysis and cardiologic analysis, and you can see, in France or everywhere in the world, when you have I do my job for 30 years. So I'm nearly an old pharmaceutico. And you know that I see the same treatment from the man to 50 years old. He has the same treatment all along his life. And with the biologic analysis, you can see the rain. What do you call that? The kidney. If the kidney is old, you don't have to take the same medicine. You have to change it. And we will be allowed to change it because of the age of the patient. Okay? We had support to pass a new medicine service and medication use review, the VKA, because people doesn't know really how to do it or to take it. They did a lot of mistakes, so we have conversation with them in the pharmacy. The inhaled corticoid for asthma patient and bronchitis patient, because in the south of France, I'm from the south of France, we have a lot of bronchitis patient. So we prevent with the students, we make tests and a question to the people at the pharmacy to know if they smoke, if they have big problem with bronchitis, to know the percent of people with this disease. Neural anticoagulant, because they changed the VKA to neural anticoagulant, and it's quite difficult for the people to use it. And actually, we call it conciliation pharmaceutique. It's a chronic or polymedicated patient. We have the pharmacist of the hospital who called the community pharmacy to know all the treatment of the people, to change it, to have something less important, because they have 10 medicine on the prescription. They have to be less medication, because it's quite dangerous for them. Foreseen in the future support to oral chemotherapy, but you know that I speak with Ilaria. We have in France the generic, and everybody in Spain or in Europe has it. It's quite difficult for us. It took 10 years to give the generic to the people, because a lot of people were against the pharmacist and against the job of the pharmacist. You know who? And actually, you have biosimilar. You know, in Spain, I don't know if it's the same word, the same name, Lovenox. Lovenox is an heparin. We have the biosimilar of Lovenox in France, which is coming this month. So I'm sure it will be as difficult as it was for the generic to give the biosimilar, but it's a combat. It's a little war for us, and we won the other one from the generic. We will win this one. You know, I've got on my suit a little ribbon, which is the pink ribbon, and it's prevention. It's prevention because October in France, it's Pink October, October Rosa. It's again el cáncer de la mama, again the breast cancer, because we have in the pharmacy, we make a big campaign to say to women, take care of you. The most important thing is the prevention. And now we are allowed for the vaccination. The prevention is a priority for French authorities, and the primary care, is important because, as I said to you at the beginning, the emergencies are full up in France, so we have to take it in the pharmacy for little injuries. Thank you for all. Gracias per vosotros. I finish.
Thank you. Thank you, Stephane. Thank you, colleagues, for sharing with us this interesting experience from your countries. Unfortunately, we are running quite late, so there won't be a lot of space for questions and comments, but if there is any burning issue that you would like to raise, the floor is now yours. There is a question from the lady here. Thank you.
Hi, thank you, speakers. Good afternoon to you. I have a question for all of you about rural pharmacies. I come from a very small village in Spain, just over 100 inhabitants, And I'll imagine that the same as Portugal or Ireland, the situation with the rural pharmacy now is quite bleak. Do you see these advanced services as a way to put us back in track to the rural pharmacies? Is it being any help in your countries for the rural pharmacy or for the smaller pharmacies, the provision of these services?
Thank you. Who wants to answer the question? Emma?
Thank you very much for your question. So, in Portugal, services are being promoted as something that can come in substitution of the profitability that pharmacies have traditionally had from medicines. And it is true that the services position community pharmacies in the community in a way that they act as the only healthcare center that is available in most of the rural areas. And that's why the new legislation also allows for nutritionists and nurses to be working in the pharmacy, because usually it's the only health structure that is left in those places. So people, when they need something, they go to the pharmacy. The problem is that in Portugal, although the legislation allows for all of this, then there is no remuneration from the healthcare system. Now we've just had new studies coming that the current model, the current financial model for remuneration of products, does no longer make a pharmacy sustainable. And we can't expect patients, also from, for instance, from rural areas who are not, who do not have a lot of money to spend extra on health, that they are going to pay for everything in pharmacies. We do believe that this is the way forward in order to help people, because, and in terms of rural areas, it's even more important because the other healthcare structures and the other healthcare professionals are not there. So the pharmacy is the only resource that people have. But the governments have to take this seriously in order to finance these new roles for pharmacy. Otherwise, we don't believe that it will be sustainable for pharmacies to provide all these services if we expect that the patients will pay for them. So in a way, it is a way to safeguard and to protect, not to protect, but to promote the role of the pharmacies. But we have to ensure that there is remuneration coming from the healthcare system as well.
Okay, thank you. I'm afraid we don't have time for other questions, so I would like to thank you all for your attention. I hope you found this session interesting, and I would like to thank again the speakers. Thank you.